we found Tasha Walsh, who is the CEO of Connections Plus, who has recently combined with Mountain Regional Hospice. And we welcome her today at the Alleghany Journal. Good to see you.
Hi. Yeah, glad to be here.
Tasha, very few of us know anything about hospice, and we're hoping you can enlighten us on the nature of the whole concept. And really, we hear, first of all, before we really get going, that you've got some kind of a 5-star quality rating. How'd you pull that off?
Yeah, so just about that, I mean, Medicare has been rating and ranking hospitals and nursing homes for many years. Just this past year, they started doing it for hospices. And what it does is they basically look at quality metrics and feedback from families that go through the program, and then they put it all, they do all their data stuff and they put it together, and they rate hospice organizations on a 5-star scale. And we are one of 10% of hospices across the country got 5 stars.
That keeps everybody on their toes, doesn't it?
It does, but I think that part of it comes from our core value of just really paying attention and listening to what the person needs and what the family needs, and providing that. And if we stay focused on that, all the other stuff falls in line in terms of quality scores and everything. So that really is, our core values and our mission is doing what it takes to help people. Help people enjoy life for as long as they can.
Well, you're a community-based nonprofit organization, and that has a certain aura to it. I mean, it spells commitment, right off the bat, I guess.
Yeah. We've for many years we've had the kind of the tagline of neighbors helping neighbors, and that really describes well how we approach what we do. We hire staff that live in the communities that we're serving. And we use a lot of volunteers that live in the communities. And so our way of helping and connecting people to resources, it really is, neighbors connect with each other and they help each other out. And that's really what we're about.
And do people understand clearly, I mean, when they get involved with Connections Plus, they've had a long-term doctor, most of them, and, they don't want to leave a particular relationship. And it seems to me, in speaking with you prior to this, that it is the case that they can keep that relationship with a doctor.
Absolutely. That's actually a myth and a misunderstanding that a lot of people have, including some physicians, that, if they make a referral to a advanced care healthcare organization or a hospice organization, that the patient has to change doctors. And that's not the case at all. We really work very hard to be good healthcare partners with other people in the community, other healthcare providers in the community. And in fact, for hospice care, one of the regulations is that there's a medical director so we have a medical director, we have a physician, but if a family or a patient has an attending or physician or a primary care physician, and that physician is willing to continue to work with them even while they're in hospice, then it's like the folks have 2 doctors looking out for them, which is kind of a nice thing.
I'm not sure that the average person really understands the complete process, but sometimes people will have the idea that it's just the last few days of one's life. And I'm not sure that that's accurate, is it? I mean, they can call you and you can plan over a course of several months even.
Yeah, and even longer than that. And I appreciate you asking that question, because that's one of the saddest things about doing this kind of work, is that we always hear from families after we've worked with them and their loved one has passed away. We hear from them, we wish we had brought you in sooner. And one of the things that I often tell people is that unfortunately, hospice has gotten a bad rap, if you will, of just thinking that it's the very, very end. And if somebody brings in hospice, that means, they've got 2 weeks or less left. And that's not actually hospice care. That's more of like end of life crisis management,
Right.
So you've got crisis hospice care, and then you've got quality of life hospice care. So the way hospice is actually designed is to help people in the 6 months or even before to really be able to focus on living out the rest of their lives the way they want to, rather than going back and forth to the hospital or dealing with interventions that really aren't gonna cure them. There comes a time where some people may decide, I'm tired of doing all of that. I really just want to be home. And I want to focus on living with my family. In the news in February was Jimmy Carter deciding to go into hospice care, and everybody's like, oh my gosh, he's going to die soon. He's still alive. So it's, that's really what hospice care is being able to help the patient be comfortable and focus on living life the way they want to as best they can for as long as they can.
This kind of intelligent compassion is amazing, and it's wonderful that it's available in our region. And I hope I'm not naive in saying I believe it all begins with a phone call where people can call you and be guided around the right road to begin the process.
Yeah, absolutely. All it takes is a phone call. And a lot of people think that they have to have a doctor's referral before they make the phone call. That's not necessarily the case. I mean, if somebody is just curious and wants to find out more information, we're happy to meet with someone. We always reach out to the person's doctor, and there does have to be certain diagnoses and things like that. And so there's a lot of communication that goes around the team of people that are working with someone. But you're right, it just takes a phone call. And one of the things that we're excited about with Connections Plus Healthcare and Hospice is that while hospice is the core of what we do and the biggest part of what we provide, we also provide advanced integrated healthcare, which is for folks who are dealing with serious illnesses, but aren't necessarily to the point of needing hospice care. They may still be looking for some curative treatments, but sometimes, just having some extra support in thinking through what is quality of life for me, and what kind of things do I want to go ahead and put in place now, so I have all my ducks in a row, regardless of when I need more care. And that's the type of thing, it's hard to know when that time might be. And so our folks are really good at just coming and having a conversation and helping people think through what are their choices and, what choice is going to be best for them.
This is great information for the public, and we're delighted to speak with you. I mean, this is really a great service. And hey, we finally caught up to you too.
Yeah. Well, thank you so much. I really appreciate the opportunity to speak to all your listeners.
Thanks very much indeed.
Yeah.